I'm Kara Hamilton McGraw. I'm with the March of Dimes. I'm the Director of Mission and Government Affairs. And I became involved with the Detroit Regional Infant Mortality Task Force through our shared goal, which is to reduce the amount of infant deaths in Detroit and save more moms and babies. The greatest accomplishment, I have to say, is the ongoing commitment from various partners from around the city. Folks that don't normally collaborate will come together in these meetings and discuss ideas, collaborate on campaigns with shared messaging and shared goals, which is truly an accomplishment to keep people engaged for 10 years in the same work. My most memorable story would be when they were even discussing putting the task force together and talked about getting the major health systems together, not just the health systems, but the leaders of the health system involved, get them all around the same table and talk about how we could work together. And I thought, nope, that's impossible to get all of these players in the room at the same time to discuss the same goals and all work together. And they did it. And I was pleasantly surprised, but so impressed. And the fact that the commitment of all of the organizations and health systems involved, as I mentioned before, ongoing for 10 years, all to improve the health of moms and babies. I truly see us making a larger impact in the city. The past 10 years have been great practice, great infrastructure building, and great planning and strategic initiatives. And I see us taking that even further and expanding it even further to where Detroit no longer has the highest infant mortality rate in the state.
So the Detroit Health Department is committed to making sure that every mother, every family, every baby in the city of Detroit is born healthy and thrives. Not just to their first birthday, but beyond. We are so proud to be a part of the task force because we are committed to working with our partners across the region to make sure that every baby can thrive. What's really important in all of this work is that we are all aligning and coming together and not doing siloed programs. I really love that the task force is bringing everyone to the table so that we can talk about how we can promote our programs collectively so that we can help Detroit's families.
It is without doubt one of the greatest honors of my life, not only my career, but my life, to have been able to assist Dr. Wisdom in the early days of starting the Detroit Regional Infant Mortality Reduction Task Force. We knew there were a lot of really wonderful programs already in existence. We knew that people had been working very hard for a very long time, really smart people, really dedicated people. And yet Detroit still had this very high, tragic infant mortality rate. The last moment that comes to particular mind for me, there were so many, was when we hosted the Robert Wood Johnson Foundation for our site visit prior to receiving the Local Funding Partnerships Award from them. It was at the bustling Matrix Service Center, a part of Matrix Human Services, on the east side. And we had a luncheon during our meeting with them where our community partners who we had been working with for many, many months all came and joined us. And it was following that luncheon when we went back upstairs to meet with the site visit group from Robert Wood Johnson Foundation that Polly Seitz, then of RWJF, said, "I am so impressed. Everybody knows what they are going to do in relationship to this program, involving the communities and in provider education, all to surround the women in their clinical and in their home environments and give them what they need to empower them and to help them to have not only healthy pregnancies, healthy full-term pregnancies, but to go on with lives that are as successful as they've always wanted to be." And Polly Seitz said, "It's amazing that everyone knows their role in relationship to how they will contribute to this grant if you receive it." I'll never forget that moment. And so looking back on all those early days, I am inspired by how partnership started to sew up that safety net.
Well, it's been a great partnership. I felt very engaged throughout this process, not only as a funder, so it wasn't one of those things where you just dropped your funds and your resources and you went away. I felt that the team was very much committed to ensuring that not only did they get our resources, but they got the best advice and guidance and expertise that they could garner from all of the partners. And so I really felt like a partner in this work.
The healthcare systems in the market that usually we see as competitors are coming together to collaborate. With the mantra, it's all about the moms and the babies and the health of our communities. It has nothing to do with competitors. We leave our hats at the door. We come together to work together for the health of our communities.